deadly dose. Families fighting the fentanyl crisis. A News Channel 11 special presentation brought to you by Ballad Health.
Tonight, we continue our series taking a close look at how fentanyl has shaped our community and the fight against it.
Hundreds of families across Northeast Tennessee and Southwest Virginia have lost loved ones due to fentanyl deaths in recent years.
We hope with this series we can spread some awareness and save some lives. Fentanyl's prominence in our region has increased significantly since 2019. Since then, at least 500 in our region have died from fentanyl, the number growing sharply over the last few years.
The landscape of local health care has changed to better treat those who come into hospitals experiencing the signs of an overdose.
I spoke with ER doctors and nurses on how it takes teams of medical professionals to save the life of someone after an overdose. It's 8 o'clock on a Friday morning at Bristol Regional Medical Center. Before some have had their first cup of coffee, teams here have saved a life from an overdose.
Daily, we're seeing at least one overdose here in this emergency room.
For the crew in the emergency department, this is just another Friday. And when it comes to overdoses, emergency room Dr. James Neff says care needs to be quick.
So typically these patients come in blue. Literally their skin will be blue, it's what we call cyanotic, their lips will be blue, their fingernail beds will be blue. They're not breathing or they don't have that respiratory drive, so they're just kind of unresponsive, not breathing.
So the impact on our resources at a local level is tremendous because we have to stop and we have to emergently manage these patients because it's a life or death moment for them.
ER nurse Angela Bennett walks us through step by step of what it takes for an overdose patient to regain consciousness.
They're going to bring the patient in, they've run from the front, they're exhausted because they've pulled this unresponsive patient out of the car.
Right.
And now we've got to physically pick this patient up, get them into the bed. We'll immediately go ahead and get to their head. I'm going to put the mask on them. I'm going to tilt their head back. They're unresponsive. Typically, they're pale, diaphoretic. Do they have a pulse? Check for a pulse. And then go ahead and administer a breath. Okay. So we're going to use our ambu bag to administer 100% oxygen to this patient because we're trying to save their heart, save their brain.
Sure.
I'll have another team member starting an IV on the patient. Another team member will be grabbing the Narcan. And then while we're sitting here reviving the patient, the doctor will be here assessing the patient. We're going to put them on a cardiac monitor and go ahead and get their vital signs and continue on with that airway, breathing, circulation, making sure that they're getting the oxygen they need. Once we administer the Narcan, we'll give them one dose. They may go ahead and open their eyes and kind of look around. Sometimes they start coming up out of the bed like, what is going on? But then hopefully the Narcan works. If it doesn't work, we'll give a second dose. Okay. Once we give the second dose, then the doctor's going to decide if we need to go ahead and intubate this patient and put them on life support. Okay. So if they're not responding to it, we're going to try to protect their airway, protect their brain, protect their heart, their vital organs.
All of this happens in just 4 to 5 minutes. Like you said, it happens fast. So this morning,
that was 5 minutes. That was
from getting him from the car
to here.
Here.
Just very quickly. All resources are on this patient.
Yeah.
Trying to save him.
Because that time is so important.
So critical.
Yeah.
Yes, because 4 minutes without oxygen, you have brain dead.
From 2019 to 2022, annual fentanyl overdose deaths skyrocketed in Northeast Tennessee, increasing 548%. It's not just in our region. Statewide deaths rose 158% during that same time period. The non-fatal overdose rate reported by hospitals rose by 76% during those years. Fentanyl does not discriminate.
The patients that we see, there's all walks of life, all social and economic factors. We see children, we see adults. Probably our average is the 30-year-old male. but we do see all spectrums of ages with overdoses.
And not every patient can be revived.
Unfortunately, it's something that we do see kind of so routinely. Certainly, I think it affects all of us more if it's a pediatric patient or a very young adult. You know, when you see an 18-year-old that loses their life for an overdose, that's just difficult to kind of wrap your head around with, and that sticks with you a little bit longer.
And you see the impact. You see the impact on the families when we cannot revive these patients. They're in these trauma rooms. They're crying for their loved ones. They want to somehow make it right, and the damage has been done.
One dose, one time. That's all it can take to end a life.
If you don't know where it came from, you don't know what it is. Unless you're getting a prescription pill from a pharmacy, you have no idea what could be in that. So the first time could be your last time.
Now, Ballad Health also has a program that screens those coming into the emergency department for intervention opportunities.
In our viewing area, fentanyl overdose deaths jumped from 51 in 2018 to 220 in 2022.
Fentanyl has changed the way law enforcement officers in our region operate. Tonight on News Channel 11 at 11, we'll tell you about new precautions in place with the surge of the drug. And you can read more about the fentanyl crisis in Northeast Tennessee and Southwest Virginia on our website. Go to WJHL.com.
Deadly Dose. Families fighting the fentanyl crisis. A News Channel 11 special presentation brought to you by Ballad Health.